Robot Talk is the podcast that sits down with robot enthusiasts from around the world and asks them the questions you always wanted answered. Like,
what's it like to perform surgery with a robot?
And how does that thing work? Hello everyone! Welcome to Robot Talk. I'm your host, Claire Asher,
and this week we're returning to the topic of surgical robotics to hear from one of the pioneers in the field.
Before we get started, I'd like to remind you to subscribe to Robot Talk through your favourite podcast provider. It really helps the podcast and means you'll be the first to hear the latest episodes. Another way to find out about new episodes is our email newsletter, which you can sign up to on our website by going to robottalk.org.
And don't forget to register for a free ticket to our live podcast recording on the 16th of June at the Victoria and Albert Museum in London. I'll be chatting to three amazing panellists about robotic prosthetics and human augmentation as part of the Great Exhibition Road Festival.
So, without further ado, I'm excited to introduce this week's guest.
I recently had a fascinating discussion with Lord Ara Darzi from Imperial College London, all about robotic surgery, past, present, and future. Today, I'm speaking to Lord Ara Darzi, a professor at Imperial College London, co-director of the Institute of Global Health Innovation, co-director of the Hamlyn Centre, and a fellow of the Academy of Medical Sciences and of the Royal Society. Hi, Ara. It's a real pleasure to have you as a guest on the podcast.
Thank you.
So you've had an incredible career in medicine, and you've worked at the cutting edge of minimally invasive surgery. And of particular relevance to this podcast, you led the team that performed the UK's first robot-assisted surgery in the year 2000 using a Da Vinci robot. So what was it like to undertake such a pioneering operation?
Obviously, on one side, it was very exciting. It was a new platform, new technology. On the other hand, it was obviously terrifying because you're doing it first time.
Yeah.
Although, the anatomy was the same, the procedure was the same. It's just the tool you were using was very, very different. It's from driving a car to flying a helicopter. So,
yeah.
But, it takes a long time to, if you look at the decade before, in other words, from the 1990s, I think that's really where the fundamental change happened, because that was the time in which we did the first keyhole procedures, what we call laparoscopic procedures. And that was transformational because we reduced the size of the incision from a very large incision to do open surgery to a tiny incision to do minimally invasive or keyhole operation. So that provided us with a decade of innovations in the field. And then that really opened the doors in terms of bringing robotics in, because what the robotics added, it made the instruments much more intuitive. It provided what we call 3-degree movements. In other words, really simulating a human hand, but a tiny being, 4 or 5 millimeters. And also gave us what we call a stereo image. In other words, the same way as I would look at you or look at me, you would look at me in a 3D, where in keyhole surgery, we're looking at 2D, where robotic surgery brought back the 3D. So robotics compensated to many of the deficits that we saw for a decade in keyhole surgery. But it was an evolutionary change from keyhole to robotics.
Yeah, absolutely. And how much time did you spend training and learning the platform before you performed the operation?
Because we've been well trained in doing keyhole surgery, actually, in fact, translating into robotics became much easier. So the threshold of doing a robotic procedure required less skill than doing it keyhole. So in many ways, it helped us. If you're a good proficient keyhole surgeon, then you were good and proficient robotic surgeon before even you started. So there were many, many advantages because it compensated for the, as I said previously, the deficits during keyhole surgery. And it took me probably we used it for about 2-3 weeks. We did a lot of lab type of work. We practiced a lot of suturing, which was a very novel way of doing it in robotic surgery. And after that, we did the first procedure, which was, I remember vividly what the case was. It was a patient who was having a gallbladder procedure, and you could just say, well, do you actually need a robot to do that? You don't. But we wanted to try the technology for the first time in a straightforward procedure.
Of course, yeah.
And the patient was very anxious about this being a robot until I had to really spend a fair bit of time explaining it's not the robot operating on them. Actually, in fact, it was me.
Yeah.
And I'm just using a different instrument.
Exactly, yeah. Yeah. I mean, yeah, truly groundbreaking, amazing stuff. So since then, what do you think are the most impactful innovations in robot surgery that you've seen in the last, 2 decades?
Well, whenever you get a disruptive innovation like that, you tend to get incremental innovations on a regular basis. And that's really has been the unique contribution of the Hamlyn Centre, which was either the cause or an effect. When we set up the Hamlyn Centre, which would have been just around the robotic era, was all about that science is moving into convergence platforms. So it's no longer talking about clinicians and engineers working together, but bringing in computer scientists and other scientists from within Imperial. And that's really what led to the creation of the Hamlyn, which has been a great center of innovation and value creation in robotic surgery.
Yeah.
And we've had numerous incremental innovations, others being able to look at a tissue, not just the surface of the tissue, but go beyond the surface of the tissue that you're looking at. Some modular robotics, they can add components to it to make it more versatile. Much more fine, very small diameter robotic catheters, which are able to go into very small vessels or very small part of the gastrointestinal tract. So a lot of innovation in that field. And I think the one that is even more exciting now is, integrating AI and artificial intelligence and machine learning in helping us to either make a diagnosis quicker using robotic surgery or even guiding, if you like, the instruments into a much more precise way as well, or using navigation underpinned with machine learning to go into target areas. So all of this is very exciting, and that's innovation keeps disrupting its predecessor technology.
Yeah. Do you see AI and machine learning as the next disruptive step, or is it more incremental to you?
I think it's disruptive in many ways in its own way, but it could also add a lot of incremental improvement to other platforms like robotics. But AI is definitely, we did our wonderful piece of work back in the year 2020, actually, nearly 4 years ago, with some work we did with DeepMind on using artificial intelligence to read mammograms. In other words, patients of having breast cancer screening program.
Yeah.
And we managed to get 15,000 beautifully annotated mammograms. And with DeepMind's unbelievable brain power in really developing these AI models, they trained an algorithm that is able now, after the 15,000, we had another 100,000. The algorithm actually could report a mammogram as good as a human being, if not better. So that's the use in a static image. But, you can also make the case this could also be used in a moving image, in other words, during surgery, in guiding you as a surgeon, and also trying to reduce any collateral damage if you're operating in certain areas that the AI may protect by stopping the instruments intervening in certain areas where you might damage a nerve, for example, and so on and so forth. Yeah.
Amazing. So you're chair of the NHS Accelerated Access Collaborative, which aims to streamline the adoption of new healthcare innovations. And something I hear frequently from people who are working in medical robotics is that the process of getting new technologies into hospitals and clinics can often be very challenging, a very long process. So how is the AAC supporting the uptake of new robotics innovations in surgery and healthcare?
Yeah, well, let me first of all start by adoption of technology in healthcare. And as a global issue, you always, and there's plenty of evidence out there, but, even in what we consider the best adopters, like the US and other countries, in actual fact, in healthcare, the adoption is slower than any other sector.
Yeah.
So we look at finance and you look at healthcare is always the most conservative when it comes to adoption of any new innovation, let alone robotics. Yeah. And that's an issue. The Accelerated Access Collaborative, which in many ways, it's looking at how could we measure but also improve the adoption and diffusion of innovations that have already proven they're worthwhile.
Yeah.
In other words, through the regulators, which is MHRA, or even NICE. In other words, they are actual fact value-creating opportunities. And when it comes to medtech and robotics, to be fair, although there hasn't been a formal appraisal of this by NICE, but, it was very slow at the beginning, as you may know, from the year 2000 till about 2007, 6 or 7, I think. We were the only centre in the whole of the British Isles, not just the United Kingdom, including Ireland and Northern Ireland, that we were doing robotic surgery. And then after that, there's been a reasonable diffusion. I think there's about 29 or 30 systems now, maybe more.
Yeah.
And so it takes a while for diffusion, but it's no different in robotics that would have been in a new drug or a new platform. And the AAC's role is, how could we really drive that? And based on the principle that I believe in, you cannot push things down. You can actually need to create the pull. And the only way you can create the pull is you look at patient pathways and then you say, okay, if I transform this pathway with the technology, then it's going to create the pull and it's going to actually, the value creation would be obvious. And the most famous one, which I was involved in, was the reconfiguration of the stroke pathway in London, in which we demonstrated we can save 200 lives, improve the morbidity of stroke, but also save a lot of money. And that was a wonderful example of the innovation that actually, so AAC's value proposition is to encourage more of that.
Mm-hmm. Sure. What do you think are the next big milestones for surgical robotics?
Obviously, listen, it's incremental and you always fail in predicting the future, but we're seeing robots becoming significantly smaller, much more intuitive, much more automated, and, better imaging, better sensing, allowing all sorts of other technologies to be integrated as part of the robot, including navigation, but you can imagine a world that, we're getting so used to, if we are driving to a place that we've never been before, to use the navigating system in your system, the idea of having auto navigation in robotics as well to take you precisely to the area that you need to be in. All of these are, and that's the integration, by the way, of a number of different sort of data sources. That is imaging, that is previous MRIs that you can integrate and overlap. So a lot of exciting work is happening in robotics in research labs, including the Hamlyn Centre, and we're going to see more and more of that in the future.
Yeah, it's an incredibly exciting field. Amazing to see all the new developments. Ara, it's been absolutely fascinating chatting to you today. I've been talking to Lord Ara Darzi, a professor at Imperial College London. Thank you.
Thank you.
Thanks for listening. If you enjoy Robot Talk, I'd really appreciate it if you could share the podcast and leave a review to let us know what you think. And make sure you check out our social media channels to see a photo of a Da Vinci surgical robot that Lord Darzi and I talked about. We're at Robot Talk Pod on all the socials. Next week, I'll be talking to Simone Schürrle from ETH Zurich, all about micro-robots, medicine, and science. Until then, I've been Claire Asher, and this has been Robot Talk. Robot Talk is brought to you by the Hamlyn Centre, Imperial College London.